Happy Thursday. It is Thursday Lifetime with Dr. Chris, the Detox dentist. And sorry if I this is all wrong here. I'm trying to find a quiet spot. Today we're going to go through some questions again. I saw there was a bunch on root canals. No surprise there. And so we're going to go through those. I'm going to go look at the videos and see who posted a question and try to answer it for you guys. So I'm going to click over. And as you know, I'm going to wear my glasses so I can see. But most importantly, thank you for being part of the Thursday live, listening to me talk about root canals and biome and health and unlimiting your health essentially. So that is my goal. My goal is to help you avoid seeing the dentist like myself. And to do that, you need to follow a few very simple rules. If you don't have the right biome, you're going to be seeing me sooner or later. If you have the wrong diet, you're going to be seeing me sooner or later. And that's really the only two things that you have control over for seeing a dentist. And you can fix those. I mean, I posted the Boss Diet plenty of times. You should look it up. I'm trying to put in the links here below as well, maybe as a comment, but the Boss Diet helps you eat correctly to feed the right biome, right? Boss Biotics, oral probiotics designed specifically to rebuild your mouth with bacteria that are less carcinogenic and has a lot of incredible health benefits. That is a product we sell at bossoralhealth.com. So I would strongly suggest you review those, and if you can get that under control in about 90 days. 90 days is kind of the average, but 66 days is a pretty good rule of thumb. You will not have the same issues you have had all your life with colds, with dentistry, and so forth. It does require effort. If you have infections in your mouth, none of this will work. Very, very bluntly put, none of it will work if you have chronic inflammation in the mouth. Okay. See that all the time too. So, what do you do about that? You need to see and get a true consult with a biologic dentist. And not just a biologic dentist, but a dentist that thinks outside the box. And the frustration I have is that biologic, holistic, allopathic medicine, it doesn't even really matter what title you put to it. Dentists and doctors, it's the person who can think, right? You need a quarterback dentist. And not very many biologic or holistic or general dentists are that. So that's just the way it is. I do offer online consults, and I'm going to have a program, which I've already had once. We're testing it right now, where I go through all your records, all your current mouth problems, your x-rays, CPCD scans, all that good stuff. I'm going to go through it all, and we can do some Vibrant Wellness online testing, look for mold, look for toxins in your system, and we come up with a real plan for you to get out of the hole and get healthy in 90 days, okay? Is it cheap? No, because it takes a lot of time. So if 2,500 bucks seems reasonable to you, that's what it costs to have a consult with me to get that done. Anyhow, I'm going to go through the questions now. Back to the glasses so I can read. Number one, let's see, So a lot of people are watching these videos just before they are getting a root canal or they just had a root canal, okay? Um, the people who watch this before getting a root canal are always saying thank you and I appreciate that. And every once in a while we get like an endodontist sneaking in here trying to put some snark in the comments, but we know better. And so a lot of people are not just asking questions but thanking me for making some good points about root canals, which is great. So yeah, you're welcome. That's exactly what I'm here for, is to give you the entire gamut of options for you, not just you need a root canal or you need an extraction, right? Because that's really not the truth. You need what's best for you. All right. There's a question by these names are interesting. Sweet Hack Y6E. I'm having a swelling in the front two teeth. My dog said they should do root canal. Um, The bone has been fully dissolved and is infected. and is accumulating food particles. But I feel my teeth is alive and not worried about the swelling, um, no pain, and wants to know if they should go for a root canal. So here's the thing about swellings or fistulas or little tiny bubbles on the side of your mouth or next to the tooth that apparently has the problem. That's called a fistula, okay? So if a tooth, doesn't matter if it's a front tooth, a back tooth, if a tooth has a bump on the side of it or above it at the gum, that most likely is the infection draining from the root into your mouth, okay? And that's called the fistula tract, or from the root apex, the end of your root, it creates a tract all the way out into your mouth. It needs to relieve pressure, right? And once that pressure is released into your mouth, the pus starts to pour into your mouth, it doesn't hurt because the pain comes from the pressure or the throbbing inside your bone. And unfortunately, a lot of patients, when they have a fistula tract, they don't even see it. They may smell it, but they don't see it. And then they think everything's fine. They think it could be a gum infection, but most likely it's a dead root. So if you have a fistula tract and you have an X-ray to show where it comes from, and there's a really good way to actually determine where that fistula comes from. I'll tell you that in a second. Then the tooth is dead. If the tooth is dead, you have two choices, right? You can have an endodontist do a root canal, or you can have it removed. Those are the two choices. If you wait and you leave it there, you're allowing a chronic infection to get worse and worse and worse. And that's worse than any of the things we discussed. So do not let it get worse. So if a dentist has taken x-rays and a 3D scan, CBCT, and still can't figure out where that fistula tract goes to, they can take a little gutta percha point or a point of rubber. It's what we used inside the tooth to do root canal filling. It's called gutta percha. It's tree rubber, essentially. We can thread that through that little opening above the tooth in that fistula, and it will create a little, curling line until it gets right to where that origin of the fistula is. We put it in there, then we take an x-ray. It shows up on x-rays. And on the x-ray, it'll do this, and it'll point right to the tooth where that problem is coming from. So that's a really good trick, and a lot of dentists do use that, but don't randomly pull teeth, randomly do root canals unless you're 100% sure which one it is. This is one way of ensuring you know which one it is, okay? So there you go. That is number one. Let's go to the next question, which would be, yep. Now, find a biological dentist that takes insurance. Most dentists, unfortunately, will not be slaves to insurance companies and offer poor care any longer. So that's a very difficult problem. Unfortunately, in this country, it is, yes. What if I already have a root canal and infection? So if the root canal is infected, as Scooby-Dooby 007 question asked, what if I already have a root canal and infection? Well, if the root canal is infected, then you have two choices. You can redo the root canal, or you can remove the tooth. If you follow my posts, you would understand that I probably would not do the root canal over again because I failed the first time. So I would remove it. But that is up to you and your dentist. But those are the two choices you have, okay? You do not want to leave an infected root canal. That's actually the most common thing I see in my practice. Let's see. And there's somebody that's named ABD Taya 3666. I don't understand the name, but the question is, I'm having a terrible toothache. Part of the tooth is gone, and my dentist advised me for root canal, and I have an appointment in 2 weeks. So we're ahead of that appointment. Good. Now I have to remove it, and I don't want to keep having the pain again. So you don't have to remove the tooth just because you watched my video. Okay. You have the choice of still doing the root canal. And if you watch the video, it'll give you options when I would not remove the tooth. Okay, there's an option of removing it and keeping it and doing a root canal. Sometimes I don't recommend removing the tooth. Okay, the video goes through that in great detail. So no, just because I said Um, you have the options doesn't mean you have to remove it. It is whatever you feel is best for your body. Okay. Yep, that's a good question there. A lot of people are talking about having a lot of decayed teeth. Let's go through that real quick. It's a very important point. So, a lot of you are talking about having multiple areas of decay, lots of already existing root canals, or a dentist telling you you need all your teeth root canal, you need all these teeth removed, and so forth, right? That may be true, but if that is going on in your mouth, okay, you have a serious problem that goes way beyond the result of the problem, which is decayed teeth and dying teeth and gum disease and so forth. If, and this is such a frustration, if your dentist only recommends root canals and removing teeth and doesn't get into the root cause of why you have all these problems, nothing's going to get better. Your whole body is sick, okay? Your mouth is just one part, and that's what we see. So if you're not getting to the root cause, just because you get root canals, and the pain goes away, and you save some, dead organs in your mouth, doesn't solve the fact that your whole mouth is just a window to your health, and everything's falling apart. You need to figure out where it comes from. Root cause dentistry, root cause medicine. This would involve some testing, 3D scans, CBCT, blood tests. It requires somebody who's going to look at everything. And if you don't do that, then you're just in a dental mill, like most dentists are. And that's unfortunate. But you want to get healthy, you need to find out what's going on and why you need all these problems. So yes, it's super sad when you get to the point where you have to lose all those teeth. That does happen. It does not, however, it doesn't. You don't need teeth to live. Honestly, you can live just fine without teeth. You cannot live with infected teeth very long, but you can live fine without teeth. So focus on the reason, the infections. Don't worry so much about the teeth. We can replace them later with ceramic implants. All right, on we go. Next comment or question is so somebody's talking about coconut oil pulling. Great, something other than root canals. I just tried oil pulling for the first time with Costco coconut oil, and I brushed my teeth afterwards. Um, I couldn't feel that brushing and multiple rinses with water had thoroughly cleaned my mouth, so I tried rinsing with warm salt water, and that did the trick. Okay, so Mariah's 5088 asked a good question. When you do, I did a video on oil pulling and the benefits of oil pulling, and they noticed that after they brush their teeth with regular water and some hopefully non-abrasive toothpaste, it didn't feel as clean because of the oil pulling. Well, oil pulling is oil, right? So oil and water are two different things. They're not compatible. The oil pulling has a different effect in your mouth than water does. And you don't want to use a detergent or an aggressive abrasive to remove all that protective oil. That would be completely against the whole purpose of doing oil pulling. So if you oil pull for 5 to 15 minutes, which is what it takes in your mouth with coconut oil. And yes, coconut oil is what I would recommend for that. Then when you brush afterwards, you theoretically are going to feel more slippery in the mouth, okay? And that's fine. Slippery is good. You don't need to feel squeaky clean. Squeaky clean in the mouth removes what's called the pellicle around your teeth, the protective layer that the teeth create themselves. It is not necessarily where you want to be. You need to have clean teeth, but you don't need to remove everything that is protective in your mouth. So, oil pulling and brushing are great. You don't need to go in with an aggressive sea salt mouthwash. I'm not against sea salt mouthwashes. I actually use them, recommend them. But if you put too much salt on it, it becomes abrasive, right? Salt is abrasive. So, coconut oil pulling in general is going to take a couple days for you to feel how it takes the bacteria mainly off the tongue and makes you feel fresher. Other people will notice too because your breath will be better. So coconut oil pulling is recommended. It is a habit that I have not been able to establish on a regular basis yet because 5 to 15 minutes of all morning just hasn't worked out for me yet. but it does have a lot of benefits. And the video on oil pulling goes through all of them. So check it out. Next. Yep, P. gingivalis and Alzheimer's are connected. They sure are. And P. gingivalis is the bacteria found around your gums, in deep pockets, and around root canals, and in improperly extracted teeth. Okay, the leftover bone, and it's very very bad. And once it gets into your brain, we cannot get rid of it. And Alzheimer's, is one of the reasons why you don't want P. gingivalis in your brain. Good. A lot of people are starting to comment back on the video on what to eat. Yes, the video only buy these groceries was very well received because a lot of people are curious about what to eat. And I try to create a minimal type of diet for you guys through that video so you can buy good things without breaking the bank. And yeah, there's more opinions than I could ever begin to even even answer. Um, but so be it. So a lot of frustration. Um, a lot of people are frustrated with root canals not working. So they said they had a root canal and then they waited a couple months and they get back and it's infected again. And the dentist either says number one, they give antibiotics, or number two, they want to retreat it. Let's go through that real quick because that is a touchy point. A lot of videos on root canals because everybody's asking about root canals. And a lot of people are frustrated. They go to a general dentist, they do a root canal. It feels all achy for a couple days, couple weeks, and never really gets better. So a couple months later, they go back to the dentist, and the dentist does what? Prescribes antibiotics. That doesn't work. Okay. The antibiotics will make the tooth feel better temporarily because you're able to supercharge the immune system and get rid of some of the bacteria. But you can't get into the bad treated root canal. You can't get into the dead organ that is leaking pus and toxins into your system. And then that goes on for often years. And they come back and there is a clear, larger infection around the tooth now that an x ray will show. And the dentist says, well, the root canal did fine for a while, which it didn't. But it needs to be redone because it looks like we can even get more out. We're going to send you to a specialist and so forth. It's only going to cost $3 million. Let's do that. And so they go in and they redo the root canal. You spend a lot of money. The tooth gets even more hollowed out and brittle. And the problem doesn't really go away. You still have bacteria around the root. You still have toxins leaking your system. Maybe it feels a little better for a while, but you're still in the same boat. And then people get really frustrated because now they've invested upwards of $5,000 often into a single tooth, just in root canals, okay? Not even the crowns. And it's not working. And on top of that, there comes a holistic dentist and a biologic dentist, and they tell you, hey, that root canal is a dead organ. It's never going to be quite right. It's going to possibly affect your whole body forever. And then they get upset, rightfully so. This is why informed consent ahead of time is mandatory by every dentist, biologic, non biologic. You need to discuss all the options, all the theories, okay? The theories. Let's remember, gravity is a theory, right? Theories. There's no knowing very much in this world. Um, and they need to discuss all the theories of what could happen with one side or the other. And then the patient can make the best decision. If they decide to take the risk on a root canal or removal of the tooth, it's on the patient because they've decided what's best for them, and dentists don't get in trouble. Okay, so that is a important recommendation. You are the boss. The dentist works for you. Please, 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 please make sure that the dentist understands that and looks out for your best interest. I get too many dentists that are sending me patients in frustration, and I have to talk the patients off the ledge of blaming the dentist for everything. Because the dentist often doesn't know any better. They don't mean harm. They just don't know any better. So education by the dentists on all aspects of dentistry will save them from liability, number one. And number two, the patient getting to make the decision after they've been properly informed um, is the only way to do medicine, okay? They need to know all their options. And then they can make the decision, and then the liability is on the patient again, because it's it's not about me telling you what to do. It's me about telling you what options you have. All right. I don't have a ton of time today for a live, and I don't know how to pull up a chat in here. Yes, I know. Look over here, see if I can find something. There's one person that did pull up here. Gina Davis 5750 asks the question: Can bone in your mouth be repaired? Can bone in your mouth be repaired, Gina? All right, let me get you the answer to that. So, bone regrows. So, if you break a bone, it grows back together, okay? If you if a tooth has lost bone around it, we call that periodontal disease, then we can't vertically add bone back. Not in the bottom and not on the top. We can't vertically add bone back. If we have a hole, okay, a hole, we can fill that with bone, with a bone graft, and that usually works quite well. So we need a surrounding wall to hold that bone graft in place. Yes, there are some very tricky and expensive procedures where we create a wall, we pack bone around it. So, block grafting, adding a big chunk of bone on the side. So, yes, we can regrow bone in many areas, but it's often not necessary. If you're using the proper protocols to remove teeth, then bone grows well, especially if you put an immediate implant in there. If you preserve the bone, ridge preservation, it's called, then you also minimize the bone loss. If, for instance, somebody waits many years after removing a tooth and the bone has gone away, it's very difficult, if not impossible, to rebuild the bone. When somebody has a tooth removed and they are thinking about doing an implant, the guideline is you want to get that done within 12 months, the longest. Ideally, immediately, if not immediately, 3 to 6 months. After that, the bone drops. After 12 months, especially in the top, the bone usually is significantly worse than it was when you started. And our options kind of go away. Can you do bone grafting on top? Of course you can. Sinus lifts are done all the time. It's expensive, it's not terribly successful, and there's just not a ton of bone that usually remains. That being said, the bone grafting material matters as well. I'm not a huge fan of using bone from other species. I'm also not a huge fan of using freeze dried dead bone from human beings. I would like you to use your own bone. If we're going to do bone grafting, get it from somewhere else in your mouth, like the back of the top here is called the tuberosity in the mouth. You can get it from the iliac crest, which is part of your hip. So you can get your own bone, grind it up, and use bone grafting. That is the best type of bone to use. Use that with PRF and PRP, which you draw out of your blood, and you have a pretty good chance of getting some decent bone. You also need to be healthy enough to grow bone, right? You have to be in a growing phase. If you're constantly stressed, you will not grow bone. Your body is trying to run away from the saber-toothed tiger. It's not trying to grow bone. So stress destroys your ability to heal. Lots of things like that. So once again, it's real important to have a quarterback dentist, doctor, naturopath, whatever, to manage your specific situation, point you in the right direction. A lot of people come to me and do, well, they just call me, actually, and we do phone consults. And what we talk about is their overall condition, their situation. And I already mentioned early on what that costs, but what we do is we talk about where they are at and what they can do. So that makes me their advocate, makes me their quarterback. And then if they see a dentist, at least they know they're doing the right thing. They're taking the right tests, they're eating the right foods, they're on a 90-day cycle to get as healthy as they can without going crazy. Definitely something I would recommend for anybody who's looking for answers rather than constantly being run around like a madman. All right, let's go on. Let's see if I have maybe one more question, and then I will be done for today. Too many there. I'm not going to answer a ton of the vaccine questions because it would block our account. But, let's just put it this way, we had a home birth. We don't do vaccines. We don't do anything, and the little guy doesn't get sick. Wonder about that. Fluoride, yep. I didn't mention fluoride in the video. The fluoride part of the video is in a different part of the video. So, um, but thanks for pointing that out. Da, 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 da. Lots of things about diet. All right, let's do hundreds of questions about diet. I'm gonna try to do some. All right, let me summarize that. We have so many questions about diet and what to eat. I can't even begin to answer them all. I had to stop answering them online because it's just too many. But here's the deal. Okay, you are what you eat. If you want to grow, you have to eat foods that support growth, health, protein, well balanced diet. A healing diet, okay, like the Boss diet, is a healing diet with a weekly perfect fast on Fridays, which is specifically designed to allow your body to heal and repair. No, a 16-8 fast daily does not do that unless you're vegetarian. When you're digesting, when you're digesting food, and red meat takes average 3 days, okay? When you're digesting food, you are not healing. You will not enter autophagy, not after 19 hours on a fast if your body is still digesting meat. So it's a very sad experience. A lot of people out there thinking they're doing a daily fast overnight, eating only 1 to 2 meals a day. Um, but they truly aren't fasting unless the digestive system is empty. A 16-8 fast helps a ton. It really does improve your health because you are digesting less. Your system is resting a little bit, but it's still not kicked into true fasting. Unless, again, you don't have any meat in your system. So the Boss diet is specifically designed for a healing diet, okay, to allow you to get healthier, to rebuild your biome, to make you stronger, to rebuild your mitochondria. It's not specifically designed to allow you to lose weight. Some people do, but that's not what it's designed for. You want to lose weight, you're going to have to adjust the diet. There's great programs out there like the Faster Way to Fat Loss that give you a structure that does result in losing weight, but it's not a healing diet. Okay, let's not get that confused. I'm here to help you get healthy. I'm here to help you build a stronger human being. And then, naturally, if you eat better, you tend to lose weight. You tend to have a better fat to muscle ratio and so forth. But it's not specifically designed for you to get a beach body. Okay. If you want that, do the Boss diet for 3 months, get healthy, then start a diet that's going to focus on, whatever, low fat, keto, 1 meal a day, all those things. You can do different things. But diet wise, there's not one right way to do it. I only pick the way that works for the most of the time with the people I have worked on. You need to pick a diet and you need to adjust the Boss diet to fit your specific genetics. Okay, I'm German, so I'm very aware of what my German ancestors ate, and I love those foods. They make me feel the best, and that's just naturally how my DNA reacts to my biome reacts to food. If I were to eat only Chinese food, I would most certainly not be my healthiest self, and vice versa. So find out your genetic diet based on where you grew up, where your ancestors grew up, and then incorporate that diet, that type of food, those type of foods into the Boss protein rotation diet, and you will have amazing results after 3 months. So there you go. That covers most of what I wanted to talk about today. If you want to learn more about the Boss diet, I always usually post a free link to the Boss diet below. It's free. All you have to do is put your address in it so I can send it to you. If you are interested in having a quarterback dentist give you a very thorough analysis of where you're at and give you direction, help you figure out what's best for you, you can contact me either through DM here on Instagram at Dr. Chris Hahn, or you can email me. There's probably an email in YouTube as well, and see if it's a fit. Okay, because I don't do this for everybody, and yeah, it is about $2,500, but it is worth it. I wish you guys an incredible Thursday, and we'll see you next week.